Dr. Leah, my husband has Parkinson's disease and gets frustrated that he can't achieve orgasm anymore. I try to reassure him, but how can we boost his confidence?
As with anything else, couples can minimize disruptions in their sex lives by knowing how to effectively deal with the problems that can arise. It's important to think about how these problems affect the afflicted person with Parkinson's and their partner. So it's important to know how to restore your sex lives. Parkinson's affects the autonomic nervous system, which controls sexual response and functioning. So it acts upon the neurons in the brain, causing those dopamine-producing nerve cells to die. And dopamine, that feel-good chemical, is the chemical that's going to transmit signals between the parts of the brain that usually coordinate smooth muscle movement. That's the involuntary muscle, so when you're breathing, heart, lungs. This is also critical to sexual function for two reasons. First, the dopamine drop may result in a decreased sex drive and sexual interest because you're losing that feel-good hormone. And second, lower levels of dopamine may cause a loss of balance, muscle rigidity, and even tremors when resting. So it's understandably that these slow muscle movements or even tremors can cause rigidity, and that's going to affect love-making abilities. There might also be physical pain that would make sex feel uncomfortable for someone with Parkinson's. Additionally, someone with Parkinson's may experience ED, since Parkinson's impacts the central nervous system. There are solutions here. Make sure you communicate. Many relationship issues stem from partners just avoiding these rough discussions, and you really need to discuss your concerns or fears. Lovers need to talk about what's going on in the process, the diagnosis, and how this is affecting each other in every aspect of their lives, especially their sex lives. Also, you can seek out a sex counselor. There are people that specialize in this particular area. But make sure you exemplify your support for him verbally, give him numerous compliments to maintain or boost one's self-esteem and desirability. Parkinson's symptoms typically less pronounced in the morning, so you might want to aim to make love a little early in the day, have some morning sex, but you really need to be willing to experiment. Couples need to adapt to their sexual habits and partners. Parkinson's are not. However, if you're really concerned, like I said, there are medications that can provide a hope. There are medications with dopamine agonists that can boost sex drive and can increase sexual functioning since they mimic the effects of the heightened dopamine-producing neurons. Viagra has also been helpful with significant improvements in overall sexual satisfaction, desire, ability to maintain erection, orgasm, all of these. As with anything else, when it comes to considering a medication, make sure to check with your doctor.